Now, do you really need to go to the dentist and get your cleaning done every 6 months? Or is it just a scam? Come on, just be honest with me. Look, I get it. Life can get super busy and it can be super expensive. I mean, my Chipotle bowl was like almost $15 the other day. What happened to it being $6.80? Do you really need to spend the time and the money paying for insurance or paying out of pocket to go to your dentist every 6 months just to get your teeth scraped and for them to yell at you about not flossing? I'm gonna give you the short answer. Yes, and I will explain why. The biggest reason why you need to go is because of prevention. Going to your cleanings every 6 months will prevent your teeth from hurting and prevent other problems in your mouth. A dental cleaning does more than what you would do just brushing your teeth at home. The first thing a dental cleaning does is it prevents gum disease. So what they're doing at the cleanings is not just brushing your teeth, they're also scraping off plaque and tartar. So tartar is basically this biofilm of bacteria that kind of build up, and at first that biofilm is called plaque. And plaque is really loosely attached to your teeth. And you're actually able to clean away plaque at home with your toothbrush and dental floss. But sometimes that plaque will harden. Even if you're brushing and flossing like normal, or if you neglect brushing and flossing, then it'll happen even more. But eventually that plaque will turn into tartar and kind of get stuck to your teeth. This is something you cannot remove at home. You need special dental tools to remove this tartar from your teeth. Now, disclaimer, you might be able to find some specific dental tools on Amazon that you can get to try to scrape off this tartar at home, but I would avoid doing that because you might actually cut your gums and cause some other problems if you're not careful. So just let the professionals do it. But every single dental cleaning, you're basically getting that tartar scraped off your teeth. Now, if you don't get that tartar removed, then it's going to cause a lot of inflammation. And this is what can lead to bleeding gums, and it can lead to gingivitis. Now, if you keep leaving this untreated, this gum disease will keep getting worse. And it can turn into, instead of being gingivitis, it can turn into periodontitis. So if this tartar buildup keeps building up and it starts going underneath your gums, instead of just causing inflammation above your gums, it starts causing inflammation below your gums. And at this point, it can start eating away at the bones that surround your teeth. This is one of the most common reasons that people end up in complete dentures, because all of their teeth end up getting super loose or infected because of some periodontal disease that has taken over their whole mouth. And this usually happens because of years of neglect of not going to the dentist to simply get a cleaning and get that tartar scraped off. The thing with cleanings is if you haven't had one in a while, it might be a little painful because your teeth might be a little sore, your gums are probably going to bleed a little bit, and it can be a little uncomfortable. But as you keep getting them, if you keep going regularly every 6 months, they don't hurt as much because you don't have as much of that inflammation building up and you don't have as much of that tartar that's building up, so they just keep getting easier. It's the same thing with cleaning your teeth at home. You know, when you floss your teeth at home and sometimes your gums will start to bleed, a lot of times people tell me, well, I don't floss anymore because my gums bleed. Well, that's actually the opposite of what you're supposed to do. You're supposed to keep flossing because you're supposed to keep that inflammation down. At first, your gums might be bleeding because they're super inflamed and you cleaned some of that plaque away. But if you keep doing it every day, then your gums will start to bleed less and less, and eventually they'll stop bleeding. And also, it's not just your teeth and your gums you have to worry about. What happens in your mouth will affect the rest of your body because your mouth is still part of your body. There is a strong association between gum disease and heart disease because those same bacteria that cause gum disease will eventually get into your bloodstream, and then they can make its way to your heart and your arteries and potentially cause plaques and clots to build up and then potentially lead to a heart attack or a stroke. There's also a clear link between gum disease and diabetes. Specifically, people who have diabetes and also have gum disease have a much harder time controlling their blood sugar levels. And also, at the same time, if you have uncontrolled diabetes, it actually makes your gum disease worse. So it's kind of like that never-ending cycle where if you have one, it's going to make the other one worse. And if that one starts to get worse, then the other one's going to get worse. So it's not just about controlling one thing. You have to control your mouth to help control the rest of your body. There's also links with other diseases like Alzheimer's, rheumatoid arthritis, and even having pregnancy complications. concerns, like having a premature birth. So don't just think, oh, it's my mouth, I can neglect this as long as everything else is healthy. No, if you don't have a healthy mouth, then it's impossible for the rest of your body to be healthy. Now, the other benefit you get from going to the dentist every 6 months and getting your cleanings is a dental exam. Now, dental exams are also really important because, one, you can do an oral cancer screening where you check your tongue, your lips, your throat, and also around your neck and your face to see if there's any signs of oral cancer or other sort of tumor that's forming. You'll also get your x-rays checked where you can see any sort of infection. You can evaluate your bone level to see if your bones look healthy. You can evaluate and see if there's any cavities that are starting. There's a lot of stuff you can see, especially early on, by getting your dental exams regularly. This is important because if you catch something early, that means you can also treat it early. So if you catch a cavity that's really small, then you can just get a simple filling. Or even better, if you catch a cavity that's still really small and hasn't really formed into a full cavity yet, then you can even prevent that from turning into a cavity and prevent you from ever even needing treatment in the first place. But if you keep waiting on it, then that cavity is only going to get bigger. And then eventually it can cause a lot of pain or an infection. And this is when you're going to have to dish out a lot more money to save that one particular tooth. The cost of just doing one simple filling is negligible compared to the cost of doing a root canal and a crown on a tooth. Or what's even more expensive is extracting that tooth because it's so far gone, even a root canal won't save it, and then replacing it with a dental implant. And if you're the type of person who just extracts every single tooth one by one as they cause problems, well, yeah, you could do that, but eventually you're going to have a hard time eating, and now your quality of life is going to go down, your life expectancy is going to go down because the foods you're eating aren't going to be as good, and then you're also going to be more at risk for other diseases like GERD. So yeah, the cost and the time might suck by going every 6 months and getting your exam and your cleanings every single time, but it's potentially saving you thousands, if not tens of thousands of dollars to save your teeth if you keep neglecting going. And also, the more work you get done in your mouth, the more careful you have to be, because nothing in dentistry will replace your God-given teeth. Everything that you do in your mouth might have complications, and there's a chance it might fail. So from the moment you work on a tooth, from a healthy tooth to even when it gets a small filling, that tooth has become compromised. It's become a little bit weaker, and it's become more prone to getting a new cavity or even fracturing. Most things in dentistry will not last forever, meaning you might have to dish out even more money in the future just to save those same teeth. Every day I hear someone say they haven't gone to the dentist in a long time because nothing's been hurting them. And also, every day I see people that have a huge infection because they haven't been to the dentist in years and nothing's been bothering them, and then all of a sudden one day something flared up and now their face is swollen and they're in a ton of pain. And I'm not exaggerating. I see this at least once a day, and usually more than once a day. Just because nothing is hurting you right now, it doesn't mean that nothing is actually going wrong in your mouth. And also, even if nothing is wrong right now, that doesn't mean that something won't go wrong in the future if you skip your visits. It's kind of like saying, oh, my heart doesn't bother me, so I don't need to exercise and I can eat like crap. And then you go to your checkup and you find out that you have heart disease. But then you still say, well, it's not bothering me, so I don't need to do anything about it. You're literally just waiting for a heart attack. Now, granted, some people might do that and they're perfectly fine with the risk of one day dropping dead from a heart attack. But I would say that the vast majority of people would not be okay with that, and they would want to try to do something to prevent getting a heart attack. So make sure, if you haven't gone to the dentist to get your cleaning in a while, use this as that motivation to go and just get a checkup. There was a recent study that got a lot of headlines and gave some really bad news to people who practice intermittent fasting. This article from the American Heart Association found that an 8-hour time-restricted eating window, which is basically that 16-8 fast that so many people do, will increase your risk from dying from heart disease by